Hello, everyone. It's Thursday, March the 2nd, and I'm really sorry we're so late and everything. There's so many different things going on down here right now, with the session and everything. So please bear with us and forgive us for being so late and everything. But and I'm going to hustle through this. And in fact, we kind of cut some things out that we'll get to, at the next briefing and everything. We'll do our big buck contest, announcements and a whole bunch of other things, at the next briefing. But real quickly, I'd like to tell you that the February numbers came in, and again, we are just continuing to move ahead in a really strong way. We're $111,800,000 above our estimates for the month of February, and it's a short month, 28 days. That's really good stuff. And so year-to-date collections now are $1.1 billion above estimates. So that's great news. Our unemployment rate, West Virginia's seasonally adjusted unemployment rate declined 0.2% to 3.9% in January of 2023. And this is the lowest seasonally adjusted unemployment rate for the state since June of 2022. All good stuff and everything. Biggest thing I got to announce today is about our Veterans Nursing Home in Beckley. And right here, I have with me and everything, the architect's contract and everything for us to move forward and on this 120-bed facility. It's on a 12-acre plot of land adjacent to the Jackie Withrow Hospital, just off of Eisenhower Drive. Just more and more good stuff. But at the end of the day, when it really boils right down to it, we should all take note of this. We owe our entire existence to our veterans and our active military as well. I've said it 1,000 times, and I can't be more blunt. What these people have given is unbelievable in every way. They always ask so little and have given so much. And it's absolutely the truth. It always is. So with great honor, I'm going to sign in front of all of you right now, our architectural work and everything to where we can drop the hammer and go on this. And right here's where I'm signing and everything. And so here we go, okay? All right, there you have it. Now, we're on our way to a wonderful facility that'll help so many of our veterans, and I don't know how in the world we could do anything in the great state of West Virginia, more per capita folks that have been in the military than any other state. And with all that being said, we should be proud of who we are as West Virginians and the contribution that all of us have made, or all the great folks in the military have made to make this nation what it is today. We owe everything. We owe everything we have in every way, in my opinion, to our veterans and our active military. So thank you so much from the bottom of my heart. Really makes me proud to be able to sign this and everything. And let's get on with building another wonderful facility to assist our veterans. Thank you so much. I promised you a COVID update and everything, and we've got a video. Dr. Marsh is traveling and everything, and he did this little video. Maybe if we could play that now, that'd be really good, because I do think, every time we come on, we ought to have a little COVID update and everything. And so please show that now, Jordan.
Hi, this is Clay Marsh, and it's really good to join the governor and all of you for this press briefing. This recording was done on March 1st, and I'm very happy to give a short update on COVID-19. And as I think all of us know, COVID-19 has really taken a different form now for West Virginia, for our country, and even for our world. and is more of an endemic problem than a pandemic problem right now. And that really is also consistent with the decision of the president to stop the national state of emergency on May 11th. And so as we look at COVID-19 in West Virginia, we still see that the variant that is the most dominant is the variant XBB 1.5, which is a kind of a marriage of Omicron BA2 variants that have come together. And this is still the most infectious variant that we've seen. But the good news is, as we look at the immunity that we have now in our country and in our state, it is estimated that over 90% of people have immunity to COVID-19, either through infection and recovery, immunization, or both. And that's good because what we've seen in our country is, despite COVID-19 still being an issue and causing an average of about 400 deaths a day in our country and about 1,000 deaths a day in the world, that the hospital numbers and the numbers of people dying have started to plateau a little bit. And that's important because the immunity that we have in our population in some recent studies appears to give us some protection against death and hospitalization that can last for 10 months or so after being infected and recovering. And that's particularly true for Americans and West Virginians who are not in the most vulnerable ages or in the most vulnerable conditions. And I think it's important that we start to separate how we might consider really approaching COVID-19 for West Virginians and Americans that are over 65, which is now about 90% of all the deaths in West Virginians and Americans over 65, and particularly those over 75, because now the number of deaths in America and in West Virginia has really affected this group of people the most. And now 70 to 75% of all the deaths from COVID-19 are in Americans and West Virginians over 75. So if you're in these very vulnerable older groups, over 65, over 75, or if you have an immune deficiency that has been defined and diagnosed by your healthcare team, then it's really, really important that you still pay a lot of attention to the risk of COVID-19, even if you've been infected in the past. And we want to make sure that you stay up with the most current recommendations for you to get vaccinated. And that's really by going to the vaccine calculator. We continue to keep that up, so it will give you the latest information and the most specific recommendations to be able to have, to make sure that you are up to date with all of your vaccinations. And it's also important, if you develop any symptoms or if you are around somebody who's been diagnosed with COVID-19, that you go ahead and test yourself. Because if it would happen that you are infected as well, then we know that taking the antiviral medication Paxlovid, or if you can't take Paxlovid or aren't eligible for some reason after you speak with your healthcare provider, the intravenous medicine remdesivir, those both can protect the most vulnerable part of our population even more than the vaccines alone. So we would really recommend that you pay a lot of attention to that. Make sure you're testing yourself. And if you test positive, and particularly if you're in the older age category, please contact your primary care provider and make sure that you are connecting with them so that you can get access to these antiviral agents, these medicines against the virus that does further improve your risk of not getting very sick with COVID-19, not going to the hospital, and not dying. Recently, there's been a lot of media that has come out and talked about a recent study around the impact and the effectiveness of masking. And there's a report from the Cochrane Foundation that is a very well thought out foundation that basically came up with this conclusion that masks may not be so effective to reduce the spread of viruses, including that from COVID-19. And while this is a very reliable group of people usually, on this particular study, I think when you read it carefully, it's got a lot of issues involved with it, a lot of shortcomings. And while I think that it is a valid and good group, when you look at the methods used, they used what's called randomized clinical trials, which for some things like choosing medicine A versus medicine B, or vaccine A versus vaccine B, or vaccine versus no vaccine, can be really effective. But a lot of important real world data has been done looking at the impact of masks with the spread of COVID. And also there's been some other types of research that's not clinical trials, because trying to establish the benefit of interventions like masks that have very little, risk to them for the wearers is a really different kind of research. And I think that many experts have looked at that study and seen some concerns there. But I think the bottom line for people that are watching is, if you are wearing a mask and you are in a vulnerable category, I think there's a lot of good data to suggest the mask very well may help, particularly when you're wearing it, both protect you and protect other people from you if you would happen to be infected. And while we would never at this point mandate mask wearing for anybody, there is enough information that I think is reliable and good to support your choice to wear a mask if that's what you want to do to protect yourself. But it also, I think it's important to recognize, just like it is around the country and in West Virginia, if you decide not to wear a mask, that's okay too. We want to make sure, though, again, for our most vulnerable part of our population, that we are encouraging you to follow the same smart rules than you've done before, which is wash your hands, avoid crowded indoor places where people are actively sick. If you're actively sick yourself, test yourself, but don't go out around other people. And if you do feel that wearing a mask is something that you are comfortable with, then again, we feel like that there is still ample evidence to suggest that mask wearing is a positive thing and would likely give you some benefit. So it's really great to be with you again today and with the governor, and we appreciate his leadership. And we are very, very encouraged with hospital numbers that don't seem to be jumping up, seems to be leveled off around 200 people. But COVID-19, while it has plateaued and it's changing the way that we're thinking of it, it is still a deadly infection in people who are at high risk categories, including people over 65, particularly people over 75, and for people with immunocompromised situations. And we also know that the same approach to be smart about COVID, vaccinations, et cetera, can prevent the risk of long COVID. And we know that long COVID affects about 10 to 15% of the population and can be quite disabling for people. And so that's another reason to make sure that you're taking good care of yourself and protecting yourself from COVID-19. Thank you very much. And it's great once again to be with you. And please stay safe and stay healthy. You are our greatest treasure. Thank you.
All right, thank you, Dr. Marsh, and thank you, Governor. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon, Governor. Good to see Dr. Marsh, too. I'm just wondering where you're at, Governor, concerning the PEIA bill. It passed the Senate last Saturday. It's currently being discussed in the House. No final version there, but a lot of employees, unions, they're complaining that, they're probably going to get a pay raise this year, but the increase in PEIA is going to wipe out a good chunk of their pay raise. What are your thoughts on where it stands right now, and what can you support?
Well, Mark, it's easy for me, from the standpoint of just saying this. I first and foremost believe that the tax cut is the biggest issue on the table. But secondly, let me just say this, because I really, in my world, I dodge questions. And this is what I would say, is from a PEIA standpoint, there was some discussion about, there were some folks that probably weren't real fired up about, the pay raise increases. But from the standpoint of, and there's been a lot of people along the way that have expressed all kinds of desire for us to find a way. We've got to find a way at some point in time. We've got to find a way to be able to quit kicking the can down the road and fix PEIA forever. Now, absolutely, without any question, we can, with our surpluses today, we can kick the can a little bit. But with that being said, I think, we need to give the powers to be credit where credit's due. Dr. Takubo, came up with a lot of really good work. Dr. Robach, same thing, or Rohrbach, rather, the same thing. And so from the standpoint of the Senate and the House, they now have a way, a methodology. And we know, let's again be brutally fair. For crying out loud, we know with the medical cost of, escalating all the time, we can't forevermore just turn our back and say, well, forevermore, we're going to be able to stay at a certain level. That's not going to work, and we know that and everything. But from my standpoint, what I have wanted to do and insisted upon is just this, and that is that we did not have any out-of-pocket increases in PEIA. Now, and what we've done is we've tried to cover that as best we possibly can. We're doing a pay raise that will cover, and I get this, Mark, everybody, I think, that is less than $133,000 of income, everybody that is less than that is getting some level of pay raise and getting covered on PEIA and being able to go to bed tonight and know that as the future goes forward, PEIA will go with them and exist and everything. It's not too bad a trade-off in my book in any way. At the end of the day, if you're in that bracket of $130,000 or $133,000 and everything, then your pay raise is going to pretty much wash out, and it's an even deal. But if you're below that level, which is the lion's share of everybody, when you're below that level, in all honesty, what's going to happen then is you're going to be able to basically cover PEIA and get some level of pay raise. It's not too bad a day, and get your car tax taken away, and if you're a small business, get a real break on machinery and inventory, and get a 21.25% reduction in your income tax tomorrow, and have triggers going forward that we'll be on a pathway of getting rid of our income tax in the state of West Virginia forever. Now, in my world, a good day's work by a lot of folks, and all the branches, I think, deserve a whole lot of credit for that and everything. At the end of the day, it's not perfect. Nothing's ever perfect, but from where I'm at, I've kept my promise in that your PEIA cost, even though it's a different type of vehicle, your PEIA cost is remaining constant and not going up because of your pay raise. You may not be getting quite the full 5% on the pay raise and everything, but really and truly, many folks are getting that at your lower levels and everything, and we want to rejoice in that. And I don't know exactly the numbers that I could be a little off in the numbers, but there's people that are getting their PEIA covered and a very significant pay raise as well. So Mark, I think it's a good day's work from a lot of people, and I'm an advocate that we move forward with all this and everything. And I think when you listen to what I've just said, it makes all the sense in the world. At least to me, it makes all the sense in the world. But Let me just say this one more time because I want everybody to understand. Anybody that's $133,000 or below is getting a pay raise and the increases in PEIA covered. And the people that are at a pay raise at an income at a salary level, that's a 50 or 60 or whatever $1,000 salary level, those people are getting a significant pay raise and PEIA covered, and everyone is getting rid of your car tax. Everyone that is a small business that doesn't have machinery that is appraised at more than $1 million, they're getting really a big-time reduction in their machinery and inventory tax. The disabled veterans are getting a real pop in this whole thing as well, which is really, really, really good. And everybody all across the board is getting a significant reduction in their income tax with triggers that will allow us. See, remember before I went 30, 10, 10. And you say, well, this is a long ways from that. Are you kidding me? Are you kidding me that this is a long ways from that? This is better than that. And the reason it's better than that, we don't go 30 in the first year, we go 21.25. Well, you may think, well, that's a big difference in everything. But in the second year, we can trigger up to 10. In the next year, we can trigger up to 10. And therefore, every year thereafter that was not in my plan, we can continue to trigger to get rid of this and completely eliminate the personal income tax. Now, I'm tickled to death. And there's been a lot of good work, and I salute the Senate and the House both, and all the finance chairs and everybody, good work. Plain good work. That's all there is to it.
All right, thank you, Mark. Next to Stephen Adams with Ogden Newspapers.
Steve Adams of Ogden Newspapers here. Mark and I did like a rock, paper, scissors to see who was going to ask the PEIA question first, so he beat me to it. Religious Freedom Restoration Act, of course, it's going by a different name, but that bill has passed and completed legislative action through both the House and the Senate now. What's your stance on that particular bill? Is that something that you plan to sign enthusiastically, or what is your stance on that? Thank you.
Well, Stephen, from my standpoint, I think first and foremost, the economic issues we need to address. I mean, from a standpoint of this Religious Freedom Restoration Act and everything, 23 other states have got this. And really and truly, as I understand this bill, what this bill does is protect against the government interfering with religious beliefs or citizens' rights and whatever. And so I plan to sign it, and I guess when I get it, we'll really go over it a little bit more and everything. But right now, for what I know, I plan to sign it.
All right, thanks, Steve. Governor, I'll turn it back to you.
Okay, well, I'm sorry we hustled along in the briefing today. I'm really sorry we were as late as we were. You've got to accept my apology, but no, there's so many moving parts going on right here, and a lot of really important stuff that we want to get to you, and we thank you for your patience, and we thank the media, for their patience, and we're just going to keep trying to do the good work. And I really do believe that this session that we're in right now probably has the earmarks of being the most historic of all time. And I'm really pleased how we're trying to work together, and everybody's moving in the right direction. And I'm really, really appreciative of Senate President Blair. Like I said, our finance chairs, all the different people that have really put in all the great licks and everything, and our Speaker Hanshaw and all of his great people as well. So a lot of good stuff, a lot of really good stuff going on, and I wouldn't tell you that because I don't blow smoke at anybody. All I know to do is speak the truth and move forward. But there's a lot of good stuff, and we're right on the cusp of historic stuff that's beyond belief good, beyond belief. So thank you so much.